This training will cover the 2014 HMIS Data Standards updates. We will go over changes, additions and clarifications from version 2, which came out in October 2014, to version 3, which will go into effect October 1, 2015. This video will cover general system changes. If your project is funded by RI, HPWA or SSVF, you also need to watch a program-specific video to get more details. Please pay attention to this presentation and take notes if you like. There will be a short quiz at the end. Here are the general clarifications for all HUD programs. Projects receiving funding from multiple sources must collect data elements required by all sources. So, for example, if you have one project funded by both HUD and RI, you need to ask both sets of questions. All projects that serve the homeless are encouraged to use the HMIS and should collect UDES, required performance measures and locally required elements. Now we will go through the UDES, or Universal Data Elements changes and additions. The first change is to element 3.12, Exit Destination. This element captures where a client goes when he exits the project. Previously, destination was required for heads of household and adults. Now, it will be required for all clients, including children. If a client exits without providing destination information, a response value of "No exit interview completed" should be used. Please remember to use this category if someone disappears. If you leave it blank, the destination information will come up as missing on a report. Beginning on October 1st, all persons exiting projects are required to have this element completed. The next change is for data element 3.15, Head of Household. For children who are born during the project stay, the entry date is the date of birth. This means that the child and the parent will have different entry dates. Please contact the RTFH help desk for a short tutorial on how to do this. Children of parents who have regular custody should be entered into the HMIS if the child is living with a parent during project stay, even if the custody is not full-time. If visitation is sporadic or short-term, projects can choose whether or not to enter the children. The following applies only to PSDES-funded programs. If a group of youth are served together through RI, each youth should be entered into the HMIS individually, not together as one household. The youths are the heads of the household. All data elements are required for each youth, except for parenting youth. If a youth is parenting a youth, they can be entered together as a household. The next change is to data element 3.17. Length of time on the street, in an emergency shelter or in a safe haven. In addition to the presence of a disability, these questions capture whether a client is chronically homeless. These questions have been made more clear. Currently, we are asking the question, has the client been continuously homeless for at least 1 year? Because homeless is defined as living on the street, in an emergency shelter or at a safe haven, the question will now ask about these 3 places. The questions, number of times the client has been homeless in the past 3 years, and total number of months homeless, will still be asked. The question, homeless status documented, is no longer required. When asking these questions to determine chronic homelessness, simply ask the client for their approximate answer. Don't tie client responses to definitions, nor try to qualify clients as chronically homeless yourself. The system is built with logic to determine this status. When possible, use pre-existing HMIS data to help jog the client's memory to determine the history, but data should not replace information provided by the client. If service point says one thing and the client says another, use the client's answer. To be considered continuously homeless, a client may still have had breaks in homelessness. Short breaks of 7 days or less do not count, and neither do institutional stays, like jails or hospitals, of up to 90 days. If the client knows the month or year but not the exact day, substitute the project entry day. For example, if the project entry date is November 7th, and the client knows he has been homeless since sometime in January, you may use January 7th as the day that homelessness began. which will make it an even 10 months of homelessness. Now we will talk about changes to the PSDES or program-specific data elements. The first one involves element 4.2. Income and sources. When you enter income, make sure to only include income that is recurring. Do not include one-time income, like gifts, services, vouchers, student financial aid or assets such as inheritance, insurance settlement, or Social Security back pay. Income is only counted if it is entered on the head of household, so as a general rule, only count minor's income if it is used for household expenses, but recorded on the head of household. If a minor's income is not used for the whole household, do not enter it. In addition, data should never replace required documentation or income evaluation to determine eligibility. And Social Security survivor benefits should be counted as retirement income from Social Security. Like income, non-cash benefits should be recorded with the head of household. Element 4.4 is health insurance. There is a new question, information date. This is the date the information about health insurance was received. Please update it accurately. It can be at project entry, at interim, or at exit, and should be updated throughout the project. The questions covered by health insurance can be answered yes or no. If the answer is yes, specify the insurance type. If the response is no, there is no need for any further data collection. The exception is HPWA-funded projects. For HPWA, if the answer is no, also record why each insurance type is not being received. Here are some guidelines for how to enter health insurance. Medicaid should be chosen only if the client really indicates that he receives Medicaid, or Medi-Cal. It should not be chosen if the client receives private pay or state health insurance. For Indian health insurance, you can select Medicaid. If the client accesses insurance through a health exchange, select private pay health insurance even if it is subsidized. For TRICARE, select employer-provided health care. Indigent care received by a medical provider or hospital that is not insurance should not be recorded in the HMIS. Element 4.11 is domestic violence. In addition to the questions about whether the client is a victim and about when the experience occurred, there is a new field, the question, are you currently fleeing? Beginning October 1st, all adults entering projects are required to have this data collected. Projects are not required to collect this new data on persons whose enrollments started prior to October 1, 2015. This slide pertains to outreach projects only. For contact, only the date and location of contact are required fields. Thank you for watching the presentation. All users must view this video and pass the quiz by September 30th. If they do not pass, they will be locked out of Service Point. The Service Points system will change to be compliant with the new standards on October 1st, and all of the standards need to be implemented for clients in the program then. That means, even clients who entered before October 1st need to be updated with the new data elements. Good luck on your quiz.